Good evening, friends. A very warm welcome from the Divine School of Homoeopathy to all of you. And we'll start with new session of Materia Medica. Up till now, we have learned two important remedies. The first remedy, that is the Allium Sitpa from the Liliaceae family. In comparison with Allium Sitpa, another remedy which is very close but opposite in actions, Euphrasia from the Scloperaceae family. And the third one today we're going to learn is the remedy that is the leopard's bane, the Arnica. And Arnica is from another plant family, and that is the composite. Yes, these are three important remedies, acute remedies, having their very specific actions and very useful in day-to-day homeopathic practice. Very useful. And that's why I always say that remedies which are there in second year are always useful. Those are very important remedies in our day-to-day practice. This remedy, I want to share many experiences, many. Because I have worked with Dr. Nitin Bhagli sir, who was an orthopedician. I worked with him for continuously 2 years. And he has given me a permission to utilize homeopathy in each and every patient over there in his hospital. During time when I was practicing, when I was in fourth year and internship, the 2 years I was with him. And every patient we tried the homeopathic remedies. And this was the one of the important remedy at that time. Every patient, because his hospital was accident hospital. And this remedy had made a miracle over there. So there are many more experiences, but I want to share certain things which is not common and which no one knows generally. There was one patient nearly about 60, 62 years of age came to my OPD with a severe diagnosed case of prostatic enlargement with retention of urine with constipation. He was an old man and he said, Doctor, I don't want to go for operation. I want to prevent it. And that's why I'm here. And when he was talking with me, he has given very important symptom. He said that I'm having continuously a pain over there in the urethral region, and because of which I cannot sit in one place. Whenever I used to walk a lot, I always get a retention of urine. And third thing, which he has explained in Marathi, I will tell both the Marathi version as well as what it is called in English that will bear. Doctor, I used to get a flat stools. मला चपटी संडासला होती. That was his version. If you read the prostatic enlargement from your surgical book, the prostate enlarged when posteriorly it presses the rectum, and because of which the stool when passed gets absolutely flat. That posterior enlargement of the prostatic part causes a flat stools called as ribbon-like stools, which are explained in the Arnica Montana. I have given Arnica has very important features over there. Retention of urine when there is an overexertion. That is another feature of the Arnica. So I have prescribed him Arnica, and with Arnica, he recovered so nicely. I have repeated the Arnica for 15 days or 1 month with him. I have started with 30 and I have shifted it to 200. But remedy works so nicely in his case that all his problems settled, even the sore bruise feeling which was there, which has passed away, the retention stopped completely, and it was beautiful. So this is one case where I have utilized this specific symptom of the Arnica, the flat or ribbon-like stools. That was characteristic of the Arnica Montana. Second important use I used to use in my hospital. I have a gynec obstetric hospital. My wife, she is a gynecologist. So we used to use many homeopathic remedies during labor cases. And with each and every case after the labor, I used to prescribe the Arnica. Arnica has a very good role. The sore bruised feeling which comes after the delivery, the perineum, the vulva, which is which gets swollen and there is a lot of pain and sore breath, immediately it disappears. If there is a hemorrhage, that also stops. It is a wonderful remedy in obstetrics, and that's why I used to use Arnica 200 in repeated doses to those ladies. In fact, I have prepared half dram bottles of Arnica Montana 200 and I keep over there. And immediately after the delivery, I used to start the doses. I used to give it with the patient to continue with it. That is the second important use I used to use. One more case I want to share. It was big back, nearly 15 years back. My one of the students who used to practice in Nasik, he called me and he was in hurry. And he called me, sir, very urgency is there. My best friend had got an accident, and it was worst accident. Nearly about he was taken to the Nagji hospital. At that time, it was Lifeline Hospital was known as Nagji Hospital, and he was taken over there. But he has multiple fractures, and no one considers that he will survive. So, what should I do? Shall I start Arnica? Yes, I said give Arnica 10 m to start immediately. So within first 5 minutes, he got the Arnica 10 m. Because of Arnica, his vitality survived. He bled a lot. Nearly about 35 fractures were there, and he was admitted in that hospital consecutively nearly about 9 months. And multiple operations have been done. And this fellow is a big fellow in Nashik. He recovered so completely. He got Arnica, which stopped, controlled the bleeding, gives the vital force strength, and it is a wonderful remedy whenever there is a head injury to absorb the bleeding, the extravasation of the blood. Arnica plays very vital role. Wonderful remedy to be utilized in such types of cases is the Arnica. So these are there are many more cases. Arnica is one of the important remedy to prevent the infection. If it is a compound fracture, it is a very good remedy. It prevents the infection over there, secondary bacterial infection, even postpartum period. To prevent the infection, this remedy plays a very vital role. So that remedy, which is very useful in our day-to-day practice, is the Arnica Montana. So we'll go with the what Allens wants to say. So Arnica Montana, it is called as leopard's bane, composite E. Nervous woman. So whenever the word nervous comes, on that day I have told you, nervous means on the tip of their nerves. Their nerves are sensitive. And that's why there is pain is very important characteristic, and they are on the tip of their nerves. They are restless. Nervous are always restless because of sensitivity over there. Sanguine, plethoric person. Sanguine means bloody. Plethoric, the redness. The face is sanguine, face is red. Lively expression. They are not dull, they are active. Whenever nervous is there, they are always active. Whenever the word nervous comes, they are on the tip of their nose. They are always active. Lively expressions and very red face. Like a peram metallicum. Peram metallicum is having it, but it is a false plethora in peram metallicum. Here it is real plethora. Belladonna also has the flushed face. Belladonna because it is an inflammatory remedy. Second is for the bad effects resulting from mechanical injuries, even if received years ago. The second part of the sentence is very important. There are many cases I have treated. Patient comes to you, doctor, I'm having severe backache since last 1 year. I have lot of medicines I have consumed, but still I have not got the result. Doctor, does it has happened that when I was child, I fall down and I got a very severe injury to my back. Whether it is because of that, people talks in this sense. This second part is very important, and Arnica is a very important remedy in that specific state. When patient tells you the history, injury happens years together, years back, and patient is having till today the complaints of it. Arnica is very important remedy, specially adapted to those who remain long impressed by even slight mechanical injury. So injuries looks very small, but its impressions remains for longer time of duration. This is very important remedy. The things which are given in bold has a lot of meaning. Sore, lame, bruised feeling all through the body, as if bitten. So as if someone have beaten him. That severe blunt trauma and that pain is the characteristic of arnica, traumatic affections of the muscles. So whenever muscles gets a trauma, it is a blunt trauma, this remedy plays very vital role. We have discussed yesterday the euphrasia. Euphrasia is also having the same feature. Here in arnica, petechial hemorrhages, ecchymosis is a very important thing which is associated with it. Mechanical injury, especially with the stupor from concussion. Stupor means semi-comatose condition. Stuporous condition. Patient goes into the stupor because of injury and with from cerebral concussion. What is a concussion? Concussion is the jerk to the brain. And then because of jerk, he goes into the stupor state. Many times patient goes into a because of cerebral concussion, he goes into a mania. He he doesn't understand what he is talking. I have seen a case of my close relative who got a head injury and he was continuously abusive and it was not getting controlled even after they have given the mannitol to him. And they say it is because of brain edema, it is not coming up, etc. I have given not I have given him arnica for the purpose of injury, but I have given him natrum sulf. The psychological bad effects after a head injury is the natrum sulfuricum, and next day patient was normal. So natrum sulf is psychological or mental effects of the head injury, and arnica is to absorb the blood or any hematoma over there. The cerebral meningitis can be covered with the even meningitis covered with the help of arnica. Involuntary feces and urine that indicates the state of the person. So whenever head injury is there, the stupor is there, and involuntary passing of the stools and urine, think of arnica first. This is very important remedy. After injuries with blunt instruments like symphytum, like euphrasia, yes, that's all. Compound fractures. What is compound fractures? Compound fractures means open fracture, fracture where the bones gets opened. Compound. To prevent the infection, arnica plays very vital roles. Compound fractures and their profuse suppuration. Calendula. Yes, calendula works locally. I used to use calendula locally, and calendula is one of the very important remedy to prevent the infection as well as to produce the granulation. For the healing purpose, this is the only agent which heals the injury, producing granulation tissue. If it is a chronic injury, it heals. So this is very important remedy. One should not forget. Then what he says, concussions and contusions. Concussion means concussion means a sudden jerk. Contusions means wounds or blunt wounds, results of the shock or injury without laceration of the soft parts. So lacerations are not there. If lacerations are there, calendula is there. If it is a nerve injury, it is the ledum palm, very or hypericum. Hypericum plays very vital role over there. If it is pinpoint, then it is the ledum palm. So these are the things which one must know. Generally, calendula in mother tincture in locally, mother tincture calendula. I used to use calendula mother tincture and mother tincture works so nicely. It is a wonderful remedy for local application. Concussion and contusions results from of shock or injury without laceration of the soft parts, prevents suppuration and septic conditions and promotes absorption. So it promotes the absorption. If hematoma is there, it gets absorbed. That is a very important thing the arnica plays. It is a big role of arnica to absorb. Just a 1 month back, there was a case of ruptured ectopic pregnancy in our hospital and she was taken for operative, but she bled a lot. So I have immediately given her arnica, which tackled that time, and I have continued it. It was big hematoma which was there when opened, and it was not getting the oozing was there. Arnica controlled that, and I have given Arnica about 4 5 days, and she recovered so nicely. Nervous cannot bear the pain, whole body oversensitive. And this is a sensitive remedy like chamomilla, like coffea, like ignatia, like naxomica. All these are very sensitive remedies, nervous remedies, where on their tip of the nose. Everything on which he lies seems too hard. So if patient lies on sofa set, and he feels time being soft, and he feels, then it becomes hard. Complains constantly of it and keeps moving from place to place in search of soft parts. So he was not getting settled with that. Then he goes with another bed, and then tries. Then again it feels hard. Then he goes somewhere. This is the thing which happens with there. There is a two comparative remedies. The parts rest upon feel sore and bruised, bacteria and pyrogen. But both bacteria and pyrogen, both remedies are having one important thing. They are septicemic remedies. Bacteria, where the comparatively bradycardia is there, pyrogen, where the proportional tachycardia is there. So it is not associated with their fever, and that thing differentiates the Arnica pulsatilla and bapticia. So relative bradycardia, bapticia, relative tachycardia is pyrogen, and in both remedies are more septicemic. In bapticia, it is more of a typhoid nature. Pyrogen is also for typhoid nature, but in typhoid, whenever typhoid with acute attack, where high grade fever is there, septicemia is there, but tongue is clean, is pyrogen. When tongue is yellowish, brownish coating is there, then it is bacteria. So this is what we have to understand, the differentiation between the remedy, and then we can think logically. There is one more remedy he has mentioned: must move continually to obtain the relief from the pain, rush talks. But it is reasons are different. In Arnica, he is not feeling softness. That's why Arnica moves. Rush talks, he gets aggravated in one place, and that's why he was in search of moving here and there. Yes, I will answer your question. First, we'll finish the remedy, then I will answer all your questions. Heat of upper part of the body and coldness of lower, that is the characteristic of the remedy. The face or head and face alone is hot, the body is cool, like a sina. Sina is there, head is hot, rest of the body feels cool, that is like sina. Unconsciousness. This sentence has a meaning. Unconsciousness, when spoken to, answers correctly, but unconsciousness and remain, or delirium at once retains. This is typical with the Arnica. You go on talking with these people, they are in stuporous state. If you take them out, you discuss, or you start talking, and they answer something, and all of a sudden they goes into the same stuporous state. That is Arnica. That indicates the sensorium is affected over there because of some injury. Cause is mechanical injury. Bacteria is also having the similar type of feature. What he compares over there: falls asleep in the midst of answers or sentence, bacteria. But bacteria, it is rather different. I have told you that bacteria is a very important remedy in septicemic state, where such a delirious state happens, and patient goes into the delirious state, and in the midst of an sentence, he immediately goes into sleep. Says there is nothing the matter with him that is related with the Arnica. If you ask him what has happened, no, I'm fine, I don't have anything. That is the him with the Arnicas. Meningitis after mechanical or traumatic injury. Meningitis after trauma, after mechanical injury, from falls, concussions on the brain. So whenever the brain concussion is there and meningitis develop, first remedy to be think of Arnica. In head injury, never forget the Arnica. It is the remedy one should give. And you can give 200, 1M, 10M, even high, all those potencies works instantaneously. When suspecting exudation of blood to facilitate the absorption inside the brain, this is a wonderful remedy. Hydrocephalus. What is the hydrocephalus? that is increased CSF quantity in the ventricles of the brain. That is hydrocephalus. Here the hydrocephalus, generally it is because of associated with deathly coldness of forearm in the children. There is a differentiation. Hydrocephalus is there also in Helleborus. Hydrocephalus is there with the Apis mellifica. Hydrocephalus is there with the Apocynon. There are many more remedies, but everyone carries their own characteristic. Here, the coldness of upper extremities, very marked coldness, specifically in children. This is the characteristic with the arnica, and generally it has close relationship with the injuries. When hydrocephalus is because of diarrhea, then the remedy is bromium. Apoplexy. Apoplexy means increased blood supply, congestion to the brain, leading towards the paralysis. And not yet paralysis happened, it is paralytic states, and this remedy plays a very vital role. Apoplexy with loss of consciousness, involuntary evacuations of bowels and bladder. Apoplexy in acute attack controls the hemorrhage and aids the absorption. Apoplexy should be repeated and allowed to act for days or weeks unless symptoms call for another remedy. Whenever in Allen's keynotes, the apoplexy word is written and there is colon written, that colon is applicable to every half semicolon part. That means thereafter every half sentence is given. The apoplexy related with that, apoplexy related with that, apoplexy related with that. This is the strategy which is given in Allen's keynotes. So we have to understand that properly. So here, apoplexy with loss of consciousness, patient goes into the comatose state, stuporous state with involuntary stools and urine. This remedy is very important. That you have to understand. That is the state defined by the patient. Second important thing, acute attacks controls the hemorrhage and aids the absorption. That's why I have given arnica to that patient instantaneously. And apoplexy should be repeated and allowed to act for days, weeks, unless symptoms call for another remedy. Repetition is bearable. This remedy has the 6 to 10 days of action. And that's why this remedy you can repeat a lot. It doesn't cause any trouble to the patient. Conjunctival or retinal hemorrhage, that is very important thing. So conjunctival hemorrhage, retinal hemorrhage, due to the blunt trauma, due to the injury, sometimes it is due to the cupping, due to the severe sneezing, and one of the capillaries opens and bleeding happens. Arnica is the remedy. So conjunctival or retinal hemorrhage with extravasations from injuries or cuff, ledum and nux, two more remedies he has mentioned. Gout and rheumatism. So it is also important remedy for gouty rheumatism. With great fear of being touched and or struck by the persons coming near him. They are so sensitive, they never allow you to touch the parts, like a colchicum. So colchicum also never allows you to touch the parts. It is so sensitive. It is gout always, acute attack of gout is so acute that all signs of inflammations are present and patient is in severe pain. They never allows you to touch the parts. Cannot walk erect on account of a bruised sore sort of feeling in the pelvic region. So whenever a patient is having very severe pelvic pain and when you ask them to wake up and they keep their hands on over their pelvis and then they tries and then gets up. This is very important remedy. Tendency to small painful boils one after another, extremely sore. So this is the tendency to boils, suppurative tendency is arnica. One important thing which will never come in this Allen's keynotes, but symmetrical affections. The eruptions come symmetrically in arnica. That is very important. If acnes are symmetrical, think of arnica. If the psoriatic eruptions are symmetrical, arnica is the remedy and it works beautifully in such types of cases. If leukoderma is symmetrical, that is a type 1 vitiligo is there, then always this remedy helped a lot in my practice. Paralysis. What type of paralysis? Paralysis left-sided, where associated with pulse, full, strong, stutter, sighing, muttering. So it is not, pulse is not feeble. Here it is full, strong. So it indicates that paralysis happened because of increased blood pressure. Paralysis is because of apoplexy. And it is of left-sided paralysis. Stutter means gargar, which is rattling sound inside the respiratory tract. Sighing. Sighing means husase sodne. This is sighing. Muttering. Patient is talking just something. That is muttering. That is another thing. When patient goes in the stupor state. Belching. Belching means lot of eructations, and eructations are very typical. They are foul, they are putrid, like a rotten eggs. This is characteristic of the eructation. Dysentery with ischemia. Ischemia means difficulty in passing the urine. Fruitless urging, long interval between the stools. So patient has a dysentery, but it is not so frequent. Long intervals are there. Constipation is another feature of this, and where he has mentioned very specific feature. That's what I have explained to you. Constipation with rectum loaded, feces will not come away. Ribbon-like stools. Underline in your book. This is very important feature. Ribbon-like stools from enlarged prostate or retroverted uterus. Enlarged prostate or retroverted uterus. Uterus is going in backward direction. That is retroverted uterus. Soreness of the parts after the labor. This is what I was talking about. Prevents PPH, postpartum hemorrhage, and puerperal complications. This is very important remedy to prevent puerperal complications. Retention or incontinence of urine after the labor. Very important. Opium is first remedy. Second remedy is causticum. Third remedy is arnica. If it is because of mechanical injuries over there, specifically after labor, the arnica plays very vital role. One more feature which is not there mentioned in this book, but one important feature which gives you hint about this arnica is aversion to tobacco. Just write it on your book. There is a very marked aversion to tobacco. It is given in italics in Borix remedy. Relationship, yes, we must know the relationship. The complementary remedies are aconite, hypericum, rustox, ipecac, and veratrum. These are 5 remedies mentioned by Bori. And all remedies, if you go with the actions of the remedies, they're acute in acting. All remedies are acute, not a single chronic remedy mentioned over there. Similar to for soreness as it bruised, Baptisia, China, Phytolacca, Pyrogen, Rustox, Ruta, and Staphysagrae. All remedies are having that sore bruised feeling, but everyone has its own associated features with which you can easily differentiate and associated modalities. Rustox modalities are rather different. Ruta modalities are rather different. Aconite, they are rather different. So you can compare them. Arnica follows well after aconite, Apis, hemamelis, ipecac, veratrum, and is followed by sulfuric acid. Sulfuric acid is rather little bit deep acting remedy, which can be after the arnica you can give sulfuric acid. Specifically, if there are alcoholic problems are there, then sulfuric acid is very important remedy. In elements from spirituous liquors, that is wine, or from charcoal vapors, arnica is often indicated, like ammonium chloride, bovista. These remedies also have an aggravation because of wine. In spinal concussion, compare hypericum. Hypericum, whenever nerve injury is there, hypericum plays very vital role. But if there is an extravagation of the blood, when there is a blunt trauma to the back, it can be given along with the hypericum. Even you can give two remedies at 2 different times, and it works beautifully in such types of cases. We'll conclude with the aggravation. Aggravation, that is general modality, better aggravated by rest. When lying down and from wine, 3 important modalities are there, aggravation modalities. And amelioration from contact, from motion. But here from contact, it is generally aggravates the condition. When you touch, it aggravates. They're sensitive over there. So with contact, it is not amelioration. Generally an aggravation which you used to get, but motion definitely ameliorates because patient remains in motion because he feels aggravated whenever he lies down and the part feels hard to touch. Rus and ruta. So this is what the Alain has explained the remedy, but this is a wonderful remedy. One must think. There was one question by Dr. Venkat Raghav, sir, in fever case, what potency can be given? It depends upon the patient, specifically like typhoid fever. How the patient presents. So I used to think first about the patient's condition. What is his susceptibility? What is his state? Whether he is dull or whether it's active. If it is patient is dull, drowsy, not having lot of reaction, then it is always better to start with low potency, 30 or 200. But patient is in an active state. Patient is susceptibility is very high, and he is restless, very severe, complaining of the pain. Doctor, I'm having severe pain. Do something. I'm having lot of problems. Then in such types of cases, you have to go for high pyrogen. If you are giving pyrogen, if you check the pulse, his temperature is 100 and pulse is 140. It is a pyrogen state. You give the pyrogen 1 m in liquid doses. I used to dissolve it in water. I asked the patient to give every 15 minutes the 1 teaspoonful of it after stirring every time. That helps a lot. One more thing, what question was there that, sir, can it be used to dissolve intravascular or intra-arterial clots also, or only in hemorrhage? It is useful. Arnica has dissolving capacity when used internally for the clots. Definitely. Sir, the line hydrocephalus, deathly coldness, will you please explain it again? Deathly coldness of the hands, it has been mentioned. The hands are cold to touch. You just check cold to touch immediately. You must make a habit of keeping your hands on his head, on his palms, on his extremities, on his lower extremity. Make a habit. This is how you check the temperature with the back of the hand. You try to check it. That is very important. Arnica is an emergency medicine. The in myocardial infarction, yes, definitely. Sir, if the clots are not visible or you can't see any ecchymosis, but body pain after fall, can we give 30 to old woman? Yes, you can go for 200 also, no problem. Definitely you can go. There was one question by Madhu, some question was there. In PCOD, when both ovaries are cystic, that is symmetrical, can we think of arnica? It is related with the eruptions. In arnica, eruption symmetrical. That is the rubric in your repertory in skin chapter. Eruption symmetrical. That part is given in the repertory. If you open complete repertory, eruption symmetrical, you get the Sepilinum is one important remedy mentioned over there, along with the arnica. Arnica is another. Okay. Anything here?
Sir, one question. Sir, Dr. Utpal Pal here, sir.
Yeah.
Sir, one question. In case of injury, carbohydrate and arnica,
My
sir, for
suggestion
long ago.
my suggestion for you is to write down what you, because I'm not getting your voice clearly. It is better you write your question so that I can answer. What potency can be thought of for infant's fall? 200 is better. Mother tincture, I never use arnica. The people tells you that arnica locally works, but I have not tried arnica. Yes, I am having mother tincture, but I have not utilized arnica in such a manner. In fact, I have used arnica for hair fall. Yes, definitely. I used to put it in coconut oil and mix it with coconut oil for local application. Definitely, it used to work. Utpal, you write your question so that I can answer. Because what happens, I could not get you what you want to say. It is always better just type over there. Any specific recommended pharmacy to buy higher potencies? You can get in anywhere. You can get all those potencies very commonly.
Sir, arnica oil is sold in market in homeopathy shop. Whether arnica mother tincture is used for hair strengthening of hair?
Yes, arnica hair for hair fall, hair strengthening. Arnica is good remedy. Good remedy.
What should be the symptom?
No,
Some
it is
symptom should be there.
not. It is for local application. It is through primary action. Arnica directly have a action over hairs.
Okay.
Injury arnica versus injury of carbo-veg. Carbo-veg is the remedy, very different remedy, very different. We'll discuss that remedy and then we'll compare, because it is a big differentiation is there in the action of carbo-veg and arnica. And arnica and ruta, Dr. Bhakti, but time is not there. Only few seconds are remaining. We'll discuss it somewhere time on Tuesday. Tomorrow there will be no lecture. We'll directly meet on Tuesday and then we'll have a different remedy and discussion. On that day, I will try to answer your things. Thank you very much being there, and ask your friends to join this unique activity so that we'll have good discussions. Okay? Thanks a lot.
Thank you, sir. Thank you, sir. Good night.
Good night.
Thank you, sir.
Okay, good
Thank
night.
you, sir.
Thank you, sir.
Thank you, sir. Thank you.
Thank you, sir. Thank you.